Hi, I'm Glenée E. Davis, LA's health equity nurse. Welcome to your RX for Life, your prescription for life, where we believe that through having healthy conversations with amazing doers, everyday people can find the tools they'll need to do more, be more, and achieve more. Today, we are talking to the amazing doer, Dr. Cassandra Esperant. Her aim is to increase access and awareness when it comes to preventative health care. She is a pharmacist working in the fields of pre-exposure to HIV and HIV treatments. Please make sure that you like, share, and subscribe. This is your health equity resource. Oh, Dr. Cassandra Esperant, because success leaves clues, not only clues to business building, but clues to health and wealth. I want to say thank you for answering the call. I want to say thank you for saying yes. I want to say thank you for showing up, and thank you for not giving up. To become a pharmacist is not an easy feat. It's not
Yes,
an easy
thank
thing to
you.
do. And I am so here for this. Can you talk to us briefly about what you're working on now?
Yes, definitely. Well, first, I would like to thank you for having me on the podcast today
Thank
and
you. Thank
so I
you.
can participate in this live Facebook. So what I'm actually working on now is increasing access to patients getting preventative care for HIV. Unfortunately, the highest incidence cohorts are not receiving PrEP, unfortunately, because they have a lot of stigma when it comes to HIV prevention. And that would
Uh-huh.
include, number one, the Black homosexual man, and number
Mm,
two, it would be the Black woman. So one out of
okay.
two Black homosexual men have HIV, and one out of four Black women. So being that that's the largest group that needs it, they have the least amount of access. So my goal is to increase the awareness and the access in the urban community so that, HIV is prevented.
Wow. I'm stumped. Like, just to hear those statistics and to hear that there's so much in the way of getting to this population, your chosen population, the cohorts of Black men who are homosexual, may have a woman also, what they call living under the down low. And so that causes an increased transmission to Black women. And so
Right.
your goal is to get people to maybe take preventative measures
Exactly.
so that they
So
don't get transmitted HIV.
exactly. So, everybody has their different lifestyles, to each his
Right,
own, especially right now,
right.
COVID, because, people have time and, things are happening, right? Quarantine and chill is happening, right? So that's a fact.
Humans will be humans.
Exactly. So there's two options. We have Descovy, which is not indicated for vaginal penetration, and we have
Uh-huh.
Truvada. So when you take one tablet once daily, what happens
Mhm.
is it prevents the risk of the patient contracting HIV by 99%.
Wow.
Right.
Wow.
So STIs also have like a higher incidence right now because people are not using condoms.
Mhm.
And some people, the argument
What's SEI?
sexually transmitted infections.
Okay, sexually transmitted infections have a higher rate of transmission right now because of what?
Well, because people are not using condoms. And also,
Uh-huh.
once you have an STI, there's a higher incidence of you contracting HIV because that immune response makes
Mhm.
those cells that cause
Mhm.
HIV more reactive.
Okay,
So,
so if you have already chlamydia or maybe herpes simplex, something that keeps your skin open to outside invaders, and your body is already working on this other infection, like it'll make it easier for you to receive HIV infection from someone else.
exactly.
Okay, wow.
So, as a pharmacist, what I believe though is that pharmacists should be able to actually prescribe it per like a collaborative agreement. So that would mean that a pharmacist would work under a doctor's license and agree
Right.
for the pharmacist to prescribe it, because I think that there's a Walgreens or a CVS in every corner everywhere.
Exactly.
So
Exactly. if you're not picking up your condoms, you can pick up some medicine that's going to help you prevent it, because people
Exactly.
don't like condoms.
No.
And I guess for some people, having good sex is better for them than impeding it with a barrier like
I don't
latex.
think they're thinking about that in the moment. It's about those feelings
How
and
can
what's
we
going
get
to
them to
happen.
think though? Is what I want to know. Like how, like asking the question and getting tested with your partner before you even go there. Like that's my prevention method. And
Right.
just getting to know someone and understanding what their habits are. Like
Right.
I like to take that time to find out who that person is, who I'm letting inside of me. But I
Exactly.
get that we have different lifestyles and we have different mindsets when it comes to hooking up and having relationships or doing whatever. So if this was in like a Walgreens and you're prescribing these preps and everything, which I think is an amazing idea, how would that conversation go? Have you thought about that?
Yeah, well, I know in California, they've
Mm-hmm.
actually allowed the pharmacist to prescribe PrEP per collaborative agreement. That has actually gone through because California is very progressive. I
Right.
live in Florida, and my goal is to advocate that and to
Uh-huh.
get involved and to try to make that happen, because I live in the Southeast, and we're like on top when it
Yes.
comes to HIV. So something
Yes.
needs to happen, and we need to be
Something
more
does need to
aggressive.
happen. It needs to happen right now. And you're right. I think that California was also probably one of the first states who allowed the morning after pill without having to go to the
Exactly.
doctor. So it's very important that people who may not have access to health care and may not want to go and talk to their doctor or may not want a record of this information on their medical record to be able to, prevent diseases from occurring and infections.
Exactly.
Yeah. Oh
I love the
man.
fact that you actually brought up the post exposure prevention of
Hmm.
pregnancy. That's a great
Hmm.
idea, because I definitely feel like it goes hand in hand with the HIV prevention, because that would be
Hmm.
like the when it comes to HIV, birth control would be like PrEP, right?
Right.
And then the plan B would be like something called PEP, which is post
Right.
exposure prophylaxis, which is what you would take if you got sexually assaulted, if you're
Right.
using like an injection drug use with used needles,
Right.
or even someone who, they slept with somebody who was positive, or they're not sure
Right.
if they're positive,
Right.
right?
Right.
So that's
Yeah.
definitely something I think that, a pharmacist should be able to prescribe as well, because
Right.
again, we're the easiest accessible providers. And if we want to bring those numbers down to
Right.
prevent HIV, this needs to be easily available.
Right. I agree with you, in which we do. We want to see the numbers decrease. I mean, this has been a long fight that we've been in for, and we would like to see some improvement on the HIV transmission. And I
Definitely.
think that if we did catch those women who came in for the morning after pill, because obviously, well, not obviously, but a high percentage of those women are there because they don't want to have this continuing relationship with somebody that they just slept with.
Exactly.
And now we need to know why. Not we
Right.
need to know why, but we need to like probe and find out, were you assaulted? Were
Exactly.
you, do you know what that person's HIV status was? Like what
Exactly.
else can we do for you?
Exactly. So I think that would be an easy transition, because as a pharmacist, we're already that go-to person for the plan B. So why not
Yes,
add additional HIV preventative aspect? I just love
yes.
the vision, and I just think that it would be such an integral part in driving down these numbers.
Oh, well, I love that you're doing it. Like I said, I am here for this. What made you get into this leadership in pharmaceuticals? Like,
So I believe that it was just a calling that I had on my life, that I just had to develop, and just develop that self-development aspect of it. When I graduated from school, I was working for
mm-hmm,
one of the big box pharmacies, and I was just,
mm-hmm,
this is just not it. Like,
yeah,
there's more to my profession than this. So I'm originally from Haiti, And I'm not sure if you remember this, but in March 30th, 1990, there was a huge march in Brooklyn because what happened was the CDC actually said that Haitians were one of the H's that caused HIV. So it was Haitians, homosexuals, homophiliacs, and heroin users. And this was not scientifically based at all. And I remember being
It
like
was
5 years
fear-based,
old.
right?
Yeah,
Fear-based, yeah.
exactly. And I
Stereotypical
remember,
stuff, yeah.
exactly. And I remember being 5 years old and watching this, and I was just like, wow, like, you know, we need advocacy, you know, like I
Yeah.
have an advocacy heart. I'm always rooting for the underdog.
Me
And, you know,
too.
it's just like in my nature. And I originally wanted to be an attorney, even though I told my chemistry teacher that I didn't need his class and I was going to law school. But, you know, long and behold, I'm a pharmacist today. So it's an amazing opportunity that I could be an advocate, you know, for not only my community, the urban community, anybody who's like underserved or anybody who's the underdog. That's just what I'm here for.
I love it. And so what has been your greatest challenge to date?
I think the greatest challenge today, I'm going to be transparent, is I'm like my personality, I'm an introvert by nature, and I'm like always in my head. So the minute that I get out of my head and I focus on like whoever I'm interacting with and getting to know them, I'm my best version of myself.
Sound like I'm talking in the mirror. My grandfather told me I
Really?
should have been, yes, I should have been an attorney.
It.
But I think the thing about being an attorney is this whole advocacy thing and this whole underdog thing. But I don't really know if that's what attorneys practice, you know.
Exactly.
They practice something.
Attorneys.
Exactly. So I love it. And I love that when you were a little girl, you heard something that crossed you, that made you feel passionate and like fractured you in a way where we're like, what? How could someone think that and feel that about me? You know, so
we can take it back to
it.
disparities. Even today with this whole COVID-19 situation, they're trying to deport a lot of people from the Haitian community back to Haiti. They're COVID positive and they want to deport them, not even treat them before they deport. We're still going through challenges in today's era. It's just, you know, different kinds.
Right. And it's always us, and it's always something that has to do with disadvantaging us. And we just really, I think education in the most subtle ways for so many of our people are going to be key, like teaching them and not even really letting them know that you're learning.
Exactly. Because I don't know about you, the best way for me to be interested as like someone who's always in my head is when you empower me. If I'm not empowered, I get disengaged.
Right. So make you the hero. Like, what is it that you can do for someone? And yeah, I think that the approach that so many people in this new realm of healthcare, what I like to call a modern day healthcare, is doing to really reach out to our communities in a cohesive fashion to say, this is what I know and what I've learned, and I am you. So let's see how we can pull our resources together to create a new outcome, because we can make choices along the way, right?
Exactly. So like it would be amazing. Like I always try to put myself in other people's shoes, like to hear someone that has, you know, that's just like me, Black woman, trying to discuss this with me. I would be more receptive towards hearing the information because I know they understand the struggle.
Right. And that is so important. And that is lacking in traditional healthcare. And we need new gatekeepers before people enter in so they can be empowered and have a plan to come out the healthcare system healthy.
Yeah, definitely. Like I'll give you an example. Like I had a patient, like she happened to be HIV positive and she was having side effects. Like literally I'm downstairs, she just left her provider and she came down to me and told me to call her provider to change her medication. Just because she's that comfortable with me.
She felt that comfortable. And she probably didn't think that someone else, that her doctor would even hear her or value what it is that she was saying. Like give it a few more days or a few more weeks. And if it doesn't go away, you know, then call me, you know.
Right. It's all about
No.
connecting with people and just building that relationship. And the way I actually connected with her was she had just found out that she was positive, and I think she was trying to call her significant other to bring her money just so she can catch the bus. And that was breaking my heart. So I had $5 in my wallet, and I just went up to her, consulted her, and just discreetly just put it in her hand. And I think that made the biggest difference for her, to just make her, she's like my daughter now, you know. She's like a little bit younger, and like, you know, she's hiding from me. She's very like, you know, childish, but
yeah,
I'm just glad that that gesture could make the difference to where she's comfortable to, you know, come.
And that means a lot to me. Before I even became a registered nurse, I worked closely in a health center for women in Fort Worth, Texas, and so many women that looked like us were HIV positive. And just learning that they were HIV positive, and the way that they were being disclosed about their HIV status, everything about it was heartbreaking to me.
Yeah, it's really sad.
Everything about it was heartbreaking to me. I can just remember just in a gaze, just like oh my.
And that's also a form of prevention, keeping them on their meds, right? Because once you're undetectable, it's untransmittable. So just talking to them, engaging with them. Like for me, what I do is I tell them about like biotin, about things that can keep them confident and beautiful, you know?
How do we increase confidence in this area to stop them from doing this? Because I felt like the confidence and the esteem was such an issue missing in these women. And I didn't know how to transfer just a little bit confidence and esteem.
I just think about myself, right? I just think about myself. How do I feel confidence when I get my hair done, when I put on my little makeup, I take care of my body? So it's the same thing. Life goes on. You just take your little pill every day and you're undetectable, and you can live a normal life. You can have a relationship.
Right. Would you suggest that they tell someone, a significant other that maybe they just met, that they didn't get the HIV from, and they're seeking new relationships, that they're undetectable, or that they're positive still, but are now undetectable and unable to transmit the infection?
I would only disclose if their relationship has reached the point where they're getting ready to, you know, engage in that intimacy.
Okay.
How do you feel?
You know, I don't know. And I brought it up because I watched a TV show one time, and I can't remember the name of the TV show, but there were two gay men, and the storyline was really beautiful. Like they had a really beautiful relationship, and he had slept with him and then disclosed his status and that he's undetectable. And I felt some kind of way for both sides of the story. And I just feel like communication and accepting what comes after disclosing what it is like the most important thing. Like, tell them if they get angry, then let them calm down and you know, come back, because obviously there's an attraction there, and the attraction may be more than just a sexual relationship. It can be a lifetime relationship of support. And so, and just because somebody may be positive, I don't think that that person doesn't need to be in your life. I just feel that from the gate, it needs to be an open and honest communication, because it would be hard to trust. After that, like, I want to know what medicines my guy is on. Like, I want to know, what are you doing?
And the beautiful thing about this is that you can actually have that conversation. Like, just talk about PrEP. That opens up the doors to just having that conversation, you know?
So have you heard of PrEP?
Exactly. Let's talk about it. Or like, maybe pull up a YouTube video and you watch it together and then you talk about it. Now it just opens the doors to talk about everything, right?
Right. It does. And to be able to talk about everything really kind of leads up to having more satisfying sexual relationships as well. So that's
and you can talk about what you like, what you don't like.
Right. Because I feel like if you have sex too soon, then you kind of like boxed in to that image of yourself, that there's no going back and there's really no moving forward. You're just that.
Right.
So yeah.
So I guess the conversation should be like as early as possible, right?
As early as possible. So how do you balance it all? with your vision to do what it is that you do? Are you still working for traditional health pharmaceuticals, and then trying to get your word out there, get
Right.
people
So
interested in what it is that you're doing? Because I'm
exactly.
interested, and I think
You're
that is
interested, you
one
love
of
it.
the yes, I think that it's one of the most important angles
Right.
into increasing Black people's awareness of who they
Exactly.
are and how important our health is. In Atlanta, it's likened, the HIV rate is likened to a third world country, and there are no education going
No.
on, very little, if anything, and the whole angle is pharmaceuticals. But I think that if we can use the PrEP as well as increase knowledge and esteem into talking about these things, that we can
Definitely.
be on the forefront of closing gaps in health
Right.
disparities.
And to be honest with you, anybody who's having sex is a candidate. Like when I
Right.
have a married woman who comes in and just found out that she's positive, if she even thought that her husband was cheating on her, she would be on PrEP, right? So it's
Girl.
deep. Yes. So anybody who's having sex, give them PrEP. If they ask you for PrEP, don't ask no question. If they tell you they never had sex and they ask you for PrEP, give them PrEP.
So let me ask you, what are the side effects of PrEP before we move on? What are
So
some of the subtle, like, what are some of the side effects? Like, will I be okay taking PrEP? Like,
yeah, definitely. It doesn't really interact with much medication. So some of the side effects are headache, diarrhea, and upset stomachs and flatulence, which is standard side effects for most medications.
right. And they'll go away over time, like.
Definitely, like after a month or so, worst case scenario.
Okay.
So with Truvada, a lot of people might talk about the stigma, like in the news, about causing kidney issues. But the studies show that the minute that someone came off of the medication, everything reverted back to normal.
Okay. Okay. So are you saying that people are on the medication just for a short amount of time, for
Well, it
maybe
depends
that
on your
relationship,
lifestyle.
or?
Yeah, like your lifestyle, right? Maybe you decide to get in a relationship or you get married. It all depends because, people have some interesting lifestyles out there.
Oh, yeah. Yeah. So what's one word of advice you would give your younger self? You talked about your incidents, your experience of being 5, and the way that the government was shunning people who look like you, and even gays, and everything is everyone else's fault. So what advice would you give your younger version of yourself, being an introvert and having all these thoughts in your mind?
So for me, it would be to always be interested in getting to know other people, because sometimes we get offended by other people by how they react to us, or their opinions of us.
Right.
But the thing is that we were all created to do something here, right? It's not about what people think. It's about being obedient to our calling.
We're so much alike. Oh my God. That was amazing. Yes. Don't worry about the opinions of other people.
Worry.
Huh?
And that's
Don't
challenging. I
worry.
still struggle with that today.
Me too. But you know what you know because you're gifted to know what you know.
Exactly. The calling is placed on your heart, and you go after it. It'll
No
work
one
out.
else's.
Yeah.
So, Doctor, what is one question you wish people would ask you more often?
So personally, I hate that question when people come up to me and ask me, "What do you do?" I hate that question. At one point in my life, when I was dating, I would just tell people I taught dance, really get to know
It's
me.
Easy. You know what dance is, right?
Ask me how I'm doing. Ask me how's my mental health. Let's talk about those things.
Yeah.
You'll learn more about me, asking those type of questions versus what I do.
Right. So what is it, what question did you wish people would ask you more often personally? Just more of who you are.
What are my passions,
Yes.
or what excites me, or in what way can I add value to the world?
Nice. I love it.
I'm not here for the oversurface conversations.
Right. I get it. You are on a mission, and you want to know how you can help others get to where you need to be and how they can help you get there as well. You got so
Yes.
much talent. That is just amazing. That you are just honing it in and putting it into your focus of what it is that you want to see take place in the world. Like,
And it's very
what an
specific.
amazing
It
doer
doesn't
is.
have to be so general. Like I'm one of those
Right.
people who has like so much things going on in my mind. I'm just so
Uh-huh.
excited to have something so focused to
Mm-hmm.
just focus on and to just make a difference because, you know, like we're all called to do something here on this earth. And
Right. And it's
it's a
not
great
easy
feeling.
to do it, you
No,
know? It's not easy to do it. But it brings a type of peace and satisfaction when you do begin to uncover what that is and put it into perspective. And it
definitely.
begins to even make sense to you, because it's not going to make sense to you in the beginning. Like, it's like, what?
Exactly. And I'm still trying to navigate it. I may have to, you know, call you and ask you for advice.
Anytime, because I am here for this. I am so into being able to just help people and just to create the lifestyles that they want, and what I mean by that is by sharing, transferring information so that it's just out there, easily accessible to people who need it.
Exactly.
I've been in the healthcare system industry for almost 30 years of my life, and
Oh,
it's been time for change.
wow.
COVID-19 is shaking up some stuff, and it's unfortunate that many lives have to be lost, but the healthcare system needed a shake up. It needed
Oh
a
yeah.
shake up. It needed a restructuring. It was just a matter of time, because, you know, people come first. Our
Exactly.
health and our needs come first. And
And I personally want to see more doctors, nurses, pharmacists in management positions versus just MBAs who are calling the shots.
I get you. At my hospital, I work at the Heart Institute, and our managers are MBAs, and they're looking to, brand and bring in more people. But,
Exactly.
you know, but what about the human aspect? Like, this is the
Exactly.
healthcare industry. Like,
How
people
has your
don't know.
experience been working during like this COVID pandemic?
So, it's been a huge change. I'm still trying to make sense of it. I'm still, at home. I'm, in the quarantine, and but yet I go to work, and then I get asked these silly questions like, "Have you been exposed to anyone with COVID outside the hospital?" But what difference would it make if it was inside the hospital or outside the hospital? Is the COVID
Right.
different? Like, it's just like
Right.
it's just like COVID is here, and we're going to have to deal with it. And eventually, even if you get a mild version of the COVID-19, or you get the most worst version of it, like, our RNA is changing. Things
Right.
about us as a human being are changing, and the way that we do things. And with that, I feel that the way that we get healthcare education and preventative information should also change, because
Right.
the people
Exactly.
who, yeah, the people who are standing to benefit from it should not be the ones narrated and also. So,
Exactly. And calling the shot.
and calling the shots. Manipulators and
Yes.
narcissists have no place here. So,
Exactly.
wow. So, tell everyone how to find you, Dr. Cassandra.
Yes, definitely. So you guys can actually find me on LinkedIn, and my name is Cassandra Esperant, PharmD, or you can find me on Instagram, and my handle is the PrEP and HIV Pharmacist. So please, guys, reach out to me if you guys have questions about prevention. And there's, again, one thing I wanted to mention about prevention is that yes, HIV meds are expensive, but there's a lot of free help out there, and almost anybody can qualify. If you're insured, they cover your copays. If you don't have insurance, there's a lot of free medications given to by the manufacturers. So, there's a lot of access. I know it's just challenging. I know that it's not easy to find the access, but my goal is to increase awareness and access so that this is like readily available to everyone to, fight this epidemic called HIV.
I love it. I love it. So you hear her. She says follow her. Her handle is the PrEP and HIV Pharmacist on Instagram so that you can access and increase your access and awareness to preventing the transmission of HIV. It's time. You don't have to become HIV positive. Dr. Esperant is here to help you increase your knowledge of preventing HIV. So are there any last words that you would like to offer? Any words of advice?
So words of advice, I actually heard this quote. I was meditating last night and I heard this quote and I just fell in love with it. And it's by Isaac Newton. And the quote goes, "We build too many walls and not enough bridges." So I think that just comes full circle, whether it's your professional life, your personal, or all the relationships that you cherish in your life.
Right.
That's just something that we have to, I know during this, pandemic that we're going through, we had a lot of time to think about ourselves and, every relationship in our lives, but let's work to build bridges versus walls. And that's something I have to do personally.
Well, me too. And that's one reason why I decided to do the Amazing Doers, because like you, I'm an introvert and I really have problems with reaching out and communicating with people. But like I said at the beginning of the show here, is that through conversations, every day, through healthy conversations, every day people can find the tools they'll need to do more, be more, and achieve more. And that's what I hear. How, when you say Isaac Newton in his quote that you meditated on, I hear that being about healthy conversations. Because if we don't say what's on the inside of us, no one will know. And then there go a wall. And then we're toxic on the inside because no one's listening to us. No one's hearing us, but we haven't said anything.
Exactly.
We're not comprehending and we're not communicating.
People can't read your brain, right?
Right. No. And I really swear that people could. Like,
me too.
I'm thinking something and I'm like, why they not?
That's because we spend too much time up here.
Your brain is not a two-way channel. Your mouth is. So get it out.
Exactly.
Get it out. And even if they don't hear it, somebody else in earshot may.
Yeah, definitely.
It may not be for them or for you. It could be for someone else. And then they're like, oh my God, I needed to hear that. Because, we're educated women. We have still things to,
of course,
and give without, resorting to other ways to do it. We can stay professional and still relatable.
I personally feel that the more educated you are, the more you have to be intentional about working on the social. Struggle's real.
The struggle is real. But I can say that we still have inside connections, and we still have to work with our network on the inside of our professions. Also, I'm here on the social media primarily so that I can reach out to the consumers of healthcare who will never go to in-service or a continuing education thing. We're amongst our peers having this conversation and gaining more knowledge from them, but it never getting out to the public, which is an advantage for them. But many people, they're interested, they just don't know how to respond. And it just seems new. They're like, is that for me? Nursing information? Like, are they talking to me? Yes, we're talking right to you. Tell us what you understood and what you didn't, and then we can help you clear that up. Because it's a whole language thing. Yeah, it's a whole language thing. So I'm here, and I'm hopeful that you guys reach out to the PrEP and HIV Pharmacist and Dr. Cassandra Esperant on LinkedIn. We're looking for people that's ready to do more, be more, and achieve more. This is preventative healthcare. And as I used to park my late mother when she was alive, she would always tell us to choose good. No, I'm sorry, I messed that up. She would tell us to be good. What she was asking us to do for that day is to choose good. To choose good in everything it is that you do. So until next time, be well.
Bye.
I'm trying to figure this out. I'm trying to end it.
Thank God for editing.
I know. If I knew how to edit, child, where is this thing at?
That was
There
so
we
much
go.
fun.